Hey, you guys, it's Melissa with Cancer Fashionista, and I'm here at the Breast Rehabilitation and Lymphedema Healing Center in Westwood, New Jersey. And this is actually where I came to have my post-mastectomy therapy, and it's like an oasis. It's like a spa. They do amazing work here. So I'm going to introduce you to one of my most favorite people, Kelli Anderson. There she is. How cute is she? And she is actually the founder of this wonderful place, and she is a lymphedema specialist. And Lymphedema Awareness Month is actually in March. So I thought this would be a great opportunity to ask Kelli a couple of questions that I have about lymphedema, even though I never really had lymphedema myself. So Kelli, first of all, thank you for letting me crash your office today.
You're welcome. Hello, everybody. Welcome to Breast Rehabilitation and Lymphedema Center.
Yep. And so the first question I have for you is, how do you prevent lymphedema?
That's a great question. You don't. So lymphedema has a couple of prerequisites. Lymphedema will show itself when there's an intrusion in your lymphatic system. Your lymphatic system is basically your lymph nodes, your skin, and the water and fluid in your body. Your lymphatics is what hydrates all of your organs, muscles, and tendons. When these lymph nodes are invaded by surgery, by radiation, they can be compromised. A compromised system can sometimes, but not always, reproduce edema or lymphedema. There are patients that are more high risk for receiving lymphedema. There are patients that are no risk for getting lymphedema. Your risk goes up with the number of lymph nodes that are dissected and or radiation and or damage to the surface of the skin. I have never seen any patients that have had sentinel node biopsy and no radiation end up with lymphedema. That doesn't mean it's not possible, but those are patients that are a lower risk. So I have a lot of patients that do come into my office and the first thing they're worried about is lymphedema. Lymphedema is only going to occur if the skin in that region is tight and you have had many, many, many lymph nodes dissected, 20, 30 plus lymph nodes. Most of the patients that I see in my office, and I am not saying I'm a doctor or an expert, I'm going to simply state what I see in my office. The patients that come in here that have less than 10 lymph nodes removed, we see very little or none to lymphedema. However, if there is severe radiation damage, the risk for lymphedema goes up. If there's more than 15 to 20 lymph nodes removed with radiation, the risk goes up. But the good news is there is an FDA-approved device to track fluid levels in both the extremities at an earlier phase. If you are one of those patients that you're not sure if you're at risk for lymphedema and you want to be educated, and I know I'm that type of patient myself, and I've had a few patients come in, we simply run a 5-minute non-invasive test on you to compare extracellular fluid levels in one extremity to the other extremity. And that gives you a score. And the score is in a normal range. You're given a number, and it tells you if you're at normal range. This test can be run quarterly, it can be run monthly, depending on the risk that you have. If you have questions about your risk factors, I always tell patients to talk to their doctors. I'm always happy to talk with my patients to help ease some of the questions and the concerns, because there are people out there that really are at very little risk and are fearful that they're going to get lymphedema.
Well, thank you so much. I mean, that you just gave us so much information. Like, that's amazing. So, what happens then when you do get lymphedema? What is the best way to treat it?
Well, initially, a patient will come in and say, I don't know if I have lymphedema, my arm feels heavy. Heaviness in the arm is generally a sign that something could be backing up in the axillary region, and that's a good time actually to get that LDEX test done. If something is starting early on, the best thing to do is wear an off-the-shelf compression sleeve, which can be measured by any of your lymphedema therapists or occupational or physical therapists that have experience with compression garments. will measure and fit you for a sleeve that you can wear frequently during gym workouts, during excessive activities, to help prevent it from getting worse. And sometimes if you catch it early enough, you can retrain the system. It is possible.
Awesome. Excellent. Well, listen, I thank you so much again for letting me crash your office. And if anyone has any additional questions about lymphedema, you could always send me an email at melissa@cancerfashionista.com, or you can go to the breast rehabilitation website, which is going to be included in this blog post. So thank you so much, Kelli, and we appreciate your time.
Oh, you're welcome.